have you start off by telling me your name and your date of birth. You can just tell me your initials.
DB 101168.
Thank you. And where are you right now?
Where am I? I'm in the doctor's office.
Perfect. And what's the year?
2021.
The month?
It is February.
And the day of the week?
It's the 10th.
All right, perfect. So patient is alert and oriented times 3. Can you tell me what you did for your birthday last year?
I watched Netflix alone, sadly.
So patient's long-term memory is intact. Now I'm going to check for short-term memory. So I'm going to tell you 4 words. I want you to remember those 4 words, count backwards from 20, and then repeat those words. So it's going to be bike, cat, ball, and dog.
Okay.
Now count backwards from 20.
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Dog, cat, bike, and ball.
Perfect. Perfect. So patient is able to follow commands. Now I'm going to have you count back from 100 by 7s.
Really?
Yes.
To what number? 0?
I'm gonna just count you for a minute.
Okay. All right. So 193. Was it 86? Is that right?
Uh-huh.
86, then 79, then 72, then 65, then 58, then 51, then 40. What is it?
That's good.
Okay.
That's great. Okay, now I'm going to assess hair, skin, and nails, okay? So I'm just looking at the patient's hair. It's soft, it's smooth, and it's fully distributed across the patient's scalp. And I'm just feeling for any masses or lumps or bumps, which I don't feel any. Now I'm going to assess the patient's skin. So I'm looking at the patient's arm. I'm looking for any suspicious moles, rashes, cuts, or bruises, which I don't see any on either of the arms. I'm feeling the patient's skin. It's warm, it's dry, it's intact. It's elastic, it's non-tenting. I'm looking at the fingernails. They're clean, they're pale, they're translucent, and the capillary refills are less than 3 seconds. And same for this fingers also. I'm also going to take a look at the legs. There are also no open areas. The skin's intact. And I'd also take a look at the patient's toenails, and the capillary refills should be less than 3 seconds. Now I'm going to go to the patient's head and neck. So I'm just looking for any discoloration, any acne, or any cuts on the face, which I don't see any. I'm going to start off by palpating the patient's sinuses. I'm going to do the frontal. Any tenderness?
No.
And then the maxillary. Any tenderness there?
No.
Okay. I'm going to also palpate your temporal arteries. Okay. No thrill. It's about 2+. I'm also going to palpate your carotid arteries, 1 at a time. All right. And no thrill there too. I'm also going to palpate your thyroid, so I'm going to have you just kind of go to your side a little bit. Okay. So I don't feel any enlargement, or any nodules. Any tenderness there?
No.
Okay. I'm also going to palpate your lymph nodes. Right here. I'm going to go across your clavicle here and your axillary. Okay. Any tenderness?
No.
Okay. Next, I'm going to palpate your TMJ. I'm going to have you open up your mouth. I'll close it. All right. Any tenderness when I did that?
No.
Okay. Now I'm going to osculate your arteries. Pulses here. Okay, perfect. Now I'm going to test cranial nerve number 7. So I'm going to have you squint your eyes, raise your eyebrows, pump out your cheeks, frown. All right, and smile. Okay.
Take your ass up.
Oh, that's okay. I can see you kind of on the cheeks there. So now I'm going to go down and I'm going to assess your eyes now, okay? So I'm seeing that your scroll is white. I don't see any drainage and I don't see any discoloration or anything like that. Your irises are brown. The color is even throughout. I'm going to check your reflexes, your pupil reflexes. So I'm going to have you take a look at my first here. Okay. Okay. So your pupils are equal, round, and reactive to light. And now I'm going to check for accommodation. So by doing this, I'm going to have you follow my light or follow my pen as I go in and out. Okay. So as the pen goes in, the patient cross-eyed, so it's accommodation, and pull back out, and it's constriction. Perfect. Now I'm going to check for extraocular movement. By doing this, I'm going to have you keep your head straight and just follow my pen with your eyes, okay? And I'm going in 9 different fields here. Good. Now I'm going to check for peripheral vision. So by doing this, I'm going to have you close one of your eyes like this, and I'm just going to tell you when you feel or you see it in your peripheral vision.
I can see it. Right.
Keep looking at me.
I can see it.
Okay.
I can see it.
Okay. Now do your other eye.
I can see it.
All right.
I can see it.
Okay. Good. Next, I would check your acuity by using a Snellen chart. Since I don't have that, I'm just going to explain what I would do. So I'd have you stand about 20 feet from the chart, and I'd have you close one eye, and I'd have you read the smallest line of letters you can, and then have you do it with the other eye too. And I would just compare it to what would be if someone had 20/20 vision, okay? So next, I'm going to move to your nose. So I'm going to have you just pull down your mask a little bit. So I'm seeing that the nose is it's midline, it's both nares are symmetrical, I don't see any discharge. It doesn't look swollen or anything like that. I'm just going to use a pen light and I'm just going to look up your nose. Okay, so no obstruction. And I'm going to have you smell. So I'm going to just have you plug one of your nostrils. And I'm going to have you smell in and out. And then the other one. Okay, so both nares are painted. Now I'm going to have you smell this and tell me what you smell.
Almonds.
Okay. And then this.
Hand motion.
Perfect. And that was cranial nerve number 1. Now I'm going to go to your mouth. So I'm going to have you pull down your mask again. So I see that the patient's smile is symmetrical. The lips are pink and they're moist. So I'm going to have you open up your mouth. And have you move your tongue up, down, side to side. Okay, say ah.
Ah.
All right, so patient's tongue and oral mucosa is pink and it's moist. I didn't see any tumors or lesions or anything like that in your mouth. I usually would check your gag reflex by using a tongue depressor and put it all the way back to your throat, which would produce a gag reflex, but I won't do that today. Next, I'm going to do your ears. So I'm just looking at your ears. They're even. They're symmetrical on both sides. They're fully formed. I don't notice any discharge when I'm looking at them now. And just looking at the side, I don't see any discharge either. No obstruction. Okay, perfect. I'm going to do the whisper test. So I'm going to have you hold your hand to that ear, and I'm going to whisper 2 words. Tell me what you hear.
Cat, dog.
Perfect. Now I'm going to do the other one.
Dog, cat.
Perfect. So now I'm going to go and check your respiratory system, okay? First, I'm going to start off by checking for rheumatism. So I'm going to go to your side a little bit. Yeah. So I'm just going to have my hands on your back, and I'm going to have you say 99. This is checking for lung volume density, okay?
99. 99. 99, 99, 99, 99, 99.
Okay. Now I'm checking for your chest expansion symmetry, okay? So when I have you take a nice deep breath. Perfect. So lung extension is symmetrical on both sides. Now I'm going to percuss, okay? Okay. And now I'm going to listen. And when you feel my stethoscope, I want you to take a deep breath, okay? So your lung sounds were clear. I did not hear any adventitious breath sounds. Now I'm going to put my stethoscope down again, and I want you to say 99, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. Now I'm going to go around the front, and I'm going to do the same thing, okay?
Mm-hmm.
So I'm going to check for gravitas. All right, so 99.
99, 99, 99, 99.
Okay. And I'm going to percuss. Okay. Now I'm just going to take a listen again. Okay. So both your lungs were clear. Okay. And now I'm going to do the same thing, but I want you to say 99.
99, 99, 99, 99, 99, 99.
Okay. And that's just checking for bronchophony. And if that was positive, it's just usually like indication of pneumonia. So now I'm going to check your pulse ox. And you should be like it between 95 and 100, which you are at 98. Perfect. And now I'm going to go to the cardiac system, okay? So I'm going to be doing this with you sitting down, lying supine, and then on your left lateral side, okay?
Mm-hmm.
So I'm going to be listening to your valves. So I'm going to start with at the second right intercostal space, which is your aortic. And then the second right intercostal space on the left side, which is pulmonic. Third left intercostal space, Erb's point. Fourth left intercostal space, which is your tricuspid. And then fifth intercostal space, midclavicular line, which is their mitral. I'm going to do that again, listen with my bell. Okay. So your heart was regular. I didn't hear any abnormalities, and I did not hear any murmurs or gallops, okay? So I'm going to go ahead and have you lie down. Okay. And I'm going to just look at your jugular vein. I'm looking for any distension, which I don't see any on either side. I'm also going to palpate for your apical, which is going to be on your left fifth intercostal space in the midclavicular line, okay? Okay, which is faint, but I can feel it. Now I'm just going to take a listen to your the heart valves again, okay? Okay. Now I'm going to check your pulses. Since I already did your temporal and your carotid, I'm going to do your brachial. Okay, your radial. Your femoral. Popliteal. Posterior tibial. And dorsal tibial. Okay, so those are all about 2+. Now I'm going to have you go ahead and lie on your left side. I'm just going to take a listen again, okay?
Mm-hmm.
And then again with my bell. Okay, perfect. Now you can lay back on your back for me. And I'm going to do your abdomen now. So first I would inspect the stomach. I would do this under the shirt, but I'm not going to do that today. I would look for any dysfunction, any scars, any surgical wounds, or anything like that. And then next I would percuss. So I start in the right lower quadrant. Any tenderness?
No.
All right. Then I would take a listen. Usually I would listen for 1 to 5 minutes in each quadrant. So there's positive bowel sounds in each quadrant. Then to get the liver span, I would start on the right side on the mid-clavicular, and about the third intercostal space, I would percuss down until I heard dullness, and I'd make a line there, which is usually around the 5th intercostal. And then I'd go to the umbilical line, and I would start percussing up at the mid-clavicular line also. And then when I started hearing dullness, I would take a measurement from both of those lines, which would give you the liver span. Then I would do for deep palpation, which I won't do today. To deep palpate the liver on the right side, I would have my hand right in the coastal margin there area and then one underneath. And I would have the patient take a deep breath. And once I take a deep breath in, I'd press down with about 2 inches with my fingers here, and then I'd pull up. And then I would just feel if there's any enlargement. I would do the same thing on the right side for the patient's spleen, the left side for the patient's spleen. I just pull up intercostal space, and when the patient exhaled, I would press down. And I would do the same thing for the kidneys on each side. Then I'm going to just take a listen to your renal arteries and your femoral arteries and the aorta, okay? Okay, perfect. Now I'm going to have you roll to your side. Your left side's okay. And I'm just going to percuss your chordo vertical angle, and I'm just checking for kidney tenderness, okay? And it's going to be around the 5th or the 12th intercostal space behind your ribs here, okay? Any pain?
No.
Okay. You can lay back on your back now. Now we're going to do your muscle skeletal system. I'm going to have it to check some range of motion, okay? So I'm going to first start off with your hips. So I'm going to have you abduct your right leg.
Go out.
Yeah, out. Good. And abduct. And then with the other leg if you could. Perfect. In. And I'm going to have you go up and then down. And same with other leg. Okay. Now I'm going to have you try to push up. And then push it up and try to push down. Okay, same with this leg. Try to push down and try to press up. Okay. Good. Now I'm going to have you sit on the side. And I'm going to start with your neck range of motion. So I'm going to have you extend back, forward, rotation side to side, and then lateral bend this kind of side. Yep, perfect. Now I'm going to test your strength. I'm going to have you push against my hand. Yep. Good. Now I'm going to do your shoulders range of motion. So I'm going to have you go up in front of you, all the way up, back, and then abduct, and then adduct. Okay, perfect. And I'm going to have you shrug, and then push again. Okay, good. Now I'm going to do your elbows. So I'm going to have you flex and extend, and then flex them again, and then push against me, and then try to pull up. Okay, good. Now I'm going to do your wrist. So I'm going to have you flex and extend your wrist. Okay, and adduct and adduct. Okay, perfect. Now I'm going to have you push against my hands. Okay, and then push up, and then squeeze my fingers. Perfect. Now I'm going to do your knees. I'm going to have you flex and extend. Good. Good. And now I'm going to have you try to push against my legs, then pull, push back. All right. All right. I'm going to do your feet. So I'm going to have you dorsiflex and plantar flex. And this one. Okay. And then eversion and inversion. Perfect. All right. So now I'm going to check your reflexes. So I'm going to do your right hip. Perfect. All right. Good. And then your Achilles here. Perfect. Now I'm going to have you stand up, and I'm going to check your spine range of motion. So I'm going to have you bend and touch your toes, as much as you can, and then bend back, and then rotate, and then lateral bend. All right, perfect. Now I'm going to test your gait. So I'm going to have you walk that way. Okay, and now I'm going to have you, on your way back, I'm going to have you walk heel to toe. All right, and then walk back on your toes. You can turn around. There you go. And then walk on your heels. All right, perfect. Now I'm going to have you sit down again, and I'm going to have you roll your heel down your shin. And on the other side, perfect. I'm going to have you have your finger to your nose, and on the other one, perfect. And now I'm just going to check for sharpness or dullness. I'm going to feel the sensation. So this is what's going to feel like it's sharp, and this is soft, okay? And tell me what you feel. You can't look.
Soft. Pain. Soft. Hard. 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 Soft. 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 Hard. Soft. Soft.
All right. Perfect. Now I'm going to put something in your hand with your close your eyes, and I want you to tell me what it is.
Quarter.
Perfect. And then your other hand.
A pen.
Okay. And now I'm going to write a letter in your hand. I want you to tell me what letter it is, okay?
R.
Mm-hmm.
R.
Yep. All right. Perfect. That is everything for today. So I want to thank you for letting me do my assessment on you today.
You're welcome.